So we'll just see how things go. If it feels like we're not really adding anything to the discussion, or and in the spring we can report back to the board.
Yeah, we're good with that.
Roger, that may be ad hoc because the state is trying to do a vaccine campaign. And Malia talked with consultants yesterday. They want to double back with me, and depending on what they want.
So is that, I saw where they're gonna lower it to age 16, April 1st, is that?
Yeah, but paralleling that, they're going to do some sort of campaign vaccination. Stay tuned. I don't know much about it.
That's gonna open it up to a huge influx of people that are eligible, so you're gonna be overwhelmed all of a sudden.
Oh, on any given day or moment, I can be overwhelmed. We'll see.
All right. Thank you. All right, we'll move on to department reports, environmental health.
I'm going to talk about the poor score, but you have all the data in front of you. Food service clicks along almost month to month, about the same, except for the summer. Septic system activity has certainly picked up a little bit. Actually, quite a bit since a couple of days ago. They literally got 20 applications. And I predicted we'd see 100. So we're going to get pretty close. This was activities similar. Boring. We met with food safety staff, and some of the it was interesting that we've seen a lot lower scores coming out of COVID because there was just doing virtual inspections, right? They weren't even going into some of these facilities. And I think Jess would attest to this, that getting back in there after being off of it for a while, they're seeing violations that would have probably not happened if we would have had that consistent inspection. So you probably have noticed a couple of poor scores. Then, Jess, you want to come in and talk about Jess Green's going to talk about this low grade score.
Yeah, so Chinatown, actually Brian's and Chinatown were inspected again earlier this week. They did significantly better, although now with the snow gone, I was able to see at Chinatown, they are dumping wastewater in one of the storm drains. So I called the city went out there and they've given me feedback on the fact that there's significant blockage. So the city will be sending them a wastewater discharge violation as well. But they have corrected a lot of the critical violations, actually all of the critical violations that were noted on these scores. We are, as Joe indicated, seeing a lot more poor scores because of our absence or less frequent visiting with these facilities during the COVID-19 year 2020. I do have some numbers that I just pulled from the database if you guys are interested in that. 2017, we handed out a total of 16 poor scores that year. 2018, we handed out 21. 2019, we handed out 14. So far this year, including one that was handed out just yesterday, we have handed out 9, which puts us on a pace for potentially 40 for the year. So significant increase even over some of the years where we've had twice as many as what we did in 2018. Any questions about Chinatown or Brian's?
Or were they dumping?
They were. It appeared to me they were cleaning out greasy pots back there, and all the grease from the pots was flowing into that. I suspected it on earlier inspections, but because of the amount of snow and ice, it was difficult say for sure. On the inspection earlier this week, I could absolutely see it, all the snow and ice from back there around that drain was completely gone. And it was really easy to see. Plus they had a giant rock back there with a scrub brush in. Kind of a giveaway there, so, yeah, I immediately called the city and they're on top of it and, it's gonna have to be cleaned up. My fear upon seeing that was, if we end up with a major rain event, it could back water up on that into town, you know, that.
I mean, so not only have your inspections sort of not been in person as much, but has like a lot of the certifications.
We've passed the classes under COVID and had it in a bigger classroom, you know, to accommodate for social distancing. And the classes have, with the exception of a couple, they've been pretty full.
Okay.
People are taking the classes. You know, Chinatown and Bryan's, there's the lady that was certified over at Chinatown, hers recently expired. She's supposed to be taking that class. Bryan's has not really had one certified since the gentleman that was certified left a couple of years ago. So that's something that they are going to get somebody. And it sounds like they're going to send it. Hopefully that'll happen.
You didn't see it.
No, not really. Only due to the fact that we capped them. You know, I mean, during the largest part of the pandemic, we had them capped. I think at 20, and we see that many in there. So they were filling up. Any other questions?
Right, thanks, Jess.
Yeah, thank you for your time. Joe, I wore this mask for you, you know.
We'll have a rush.
Right here, Dan, let's make a question here. When I first joined the board, not knowing exactly what they do on the inspections, I volunteered to go on one. That's with the leader in that. It's worthwhile, a couple hours of your day. You can tell them 2 or 3 weeks in advance. So I have a Monday morning open or Wednesday, and they'll call you and want to go to Whitefish or you're this end of the county. Enlightening experience to see what they do. Gives you comfort when they get a good grade. It really is deserved. If not done it, I suggest it's worthwhile.
I've been on the receiving end.
Yes,
So yes.
yes.
I appreciate that recommendation. Yeah. I guess relative to environmental health, the head of the environmental health manager has resigned. I think she's so that was Christine Hughes. So I think we definitely need to move ahead with filling that position. So I don't know if the board needs to authorize Joe to do so or not, but I guess I would forward a recommendation to make that happen as soon as possible because of the huge amount of applications that are coming into the department. Get somebody working, reviewing and improving the process of applications. So, one thing. The other thing, I guess it's been a while since the Environmental Health Committee has actually met. And so I think we talked about that a little bit. Thought it'd be good to schedule a meeting. So I don't know how Artis, myself, Joe, and Pam are on the committee next week sometime. You guys? Any particular day?
Anytime after around 4 would be good for me. 4 to 4.
Are you busy with vaccines on Tuesday, Wednesday, Thursday? Is that?
I would just assume there's but if your schedule, I can.
What about like Friday? All right, I'll take a look at my schedule. And shoot out an email.
Roger, if you don't mind, this came up in But I was notified, Flatted County will get a considerable amount associated with wastewater. Kalispell's. We had a program before I left. We were looking at septic treatment, more of a consolidated septic treatment. So that would be a good discussion to have next week around that, especially if we can get the money. But there's a lot of sewage money in that code. So we'll have something to talk
Not even gonna go.
about. I don't think we can stop this train. We just need to get on.
All right. All right, we'll move on to the next agenda item, population health.
Wendy Hanson, Olson Hanson, will be presenting us.
Nice to be here. I haven't met a lot of the new board members, so nice to see a face and name put together. So I'm Wendy Olson Hanson. I do the Buffalo Up Montana program, so that's my contribution to population health. So Jen cost care manager from that here today. So she just asked me if I check in with you guys, see if there's any questions on our report. We are trying to the best we can maintain our programs throughout the whole pandemic and vaccination distribution. And Tuesday, Wednesdays, and Thursdays. So you'll see most of our numbers are holding fairly steady. We haven't rocked into back, pre-COVID days yet, but we're working on it. For example, like the Safe Kids, Safe Communities, that's the program that I work on. So that's the car seat safety. We have not been doing a lot of that. We still have car seats for hospital families. They live at 25 class is the class for those under the age of 25. And they've got a speeding ticket, got a crash, gone through the court system, and they've been required to take the class. The nice part, they have to pay their fine, and then the ticket goes away from their off the record. Helps with their insurance. We have a class tonight, which is kind of exciting because we haven't had one in person for a while. We're going to actually do it this room, like Jess was talking about earlier, for social distancing and doing all the right things. So looking forward to getting back on track and to programs that population health does. Any questions on our report that I can answer?
Roger, before we let Wendy go, very significantly sold herself in what she does for the health department. So she's also doing all of our logistics for our vaccine delivery, does CPR for us as CPR instructor. So she does a tremendous amount. Couldn't do it.
It's a very team effort. We have a phenomenal group down at population health. We're about the members of the health department, so thank you for joining us.
All right, thank you, Wendy.
I just had a quick question. Where are we with sharps? Are these on sharps distributions? Are these containers given to patients? And are I recall earlier, I think past summer, talking about community sharps places to dispose of sharps.
A little bit. It's not my area of expertise, but I'll tell you what I know. So the Sharps program referenced here is the one where our staff wants to bring empty containers to local pharmacies, and they in turn give them out to their clients, like diabetic needles, that sort of thing. So then we go back and collect the filled containers from pharmacies and then bring them to the landfill, so they get where they go now, which is different than our syringe exchange program. This one is just more general, pick up, drop off at the pharmacy.
In the syringe exchange, is that reported somewhere else?
It's actually a reproductive health program.
Okay.
Just a little bit on this. This partnership started a long time ago with the Sharps program. So this is a program just to keep that in a lot of harm's way with us. So you hear landfill, but the landfill has a steel secure container, and we have approval for burial out there. So these never hit the environment. So it's a good program. It's very cost effective. It eliminates a lot. It's a good partnership with our solid waste program.
Hey, guess what? Finance.
Yeah, thank you.
This is the finance report for February 1st through the 28th. Starting out, finance committee met a little earlier. We had a good discussion for the preliminary budget. So that is moving forward. Just a couple highlights from that budget. Total health department budget is about 8.3 million of that. The general fund is 3.1 million for expenditures. Then mosquito, animal shelter, CIP fund, grants, home health, et cetera, about 5. Overall, the Flathead Health Clinic is in the process, obviously, of separating from the health department. May affect the budget or may not come down the road. Grants are still in the early stages of funding, so we may see some changes in budgets from that. But the animal shelter is building going up, so if you look through the preliminary budget area, you'll see a larger expenditure for that budget. The finance department is estimating about a 1.2% cost of living adjustment, and a 5% increase in the employer side of the health insurance expenditures. Those things are in there. As this process goes along, we'll make the adjustments to the budget. One of the things we'll look for at the next board meeting is approval of the budget next April. The Flathead County administrators will review their budget on April 19th, and then the county commissioners will do in May. That's the budget, preliminary budget details. General health fund at the end of February was about 1.2 million. Again, sort of like a broken record on this. Environmental health, immunization clinic, still about the same. Environmental health doing well. Immunization clinic, of course, down. Home health, cash balance about $51,000. I got an email from Courtney a little earlier. The accounts receivable balance that I had is about 368 after the update, about 328,000. So we were able to collect about 40,000, which will increase that. And there's in the dashboards and some information. Any questions about the budget or?
I do have a comment. That we did what he said he did, what we did. The committee was Cal, myself, and the health officer, and very, very good job. As in prior years, it was very complete. Joe added that this is the first time in recent history that you've not been involved in the budget. Which makes one of two things, that you either get all the credit or if it's wrong.
That's right.
So good job.
Yes, thank you very much.
And we'll see you again in a month.
That's right.
I guess 4 weeks.
Thanks, Chris. All right, finance, so we're on to the health officer.
Well, I'm just as still, so I feel a little projecting myself and some new cases in February. You can see downward trend. That big blip was a bunch of labs that got dumped in for. It was a little alarming, but get everything going down. The bottom chart is probably very telling as we look at viral load. Case positivity rate is getting close to 5%. I mean, that would be great if we start to see it around 2%. Last week it was 4%. So we're seeing some good stuff. I overlay that with the orange line of how many tests were done. Because so many times people go, well, your positivity rate's going down because your tests are going down. Well, technically, it would be easier for your denominator to go up, right? But we're seeing pretty level testing and our positivity rate's going down. So, I mean, I'm feeling that there's enough power in this, it's really showing. We are seeing some reduction in our viral load, overall community.
Because, and that a little bit more, I mean, positivity rate, I mean, if we were seeing, we would be upsizing, we would want to be upsizing the amount of testing we're doing. Up to that.
Well,
Maybe
from
that higher testing, like, we're seeing a good indication of positivity.
So technically, the rate would actually go up if your denominator went down, right? So when I say power, I'm talking about statistical power, and I'm talking about the fact that we have a significant number of tests. If we had a lot of people just testing asymptomatically or not as an exposure, we'd see our rate go down, and that might be artificial. As long as we're seeing this normal testing, it should be good. Now, the farther we get along, and we're not seeing exposures, our testing number, the number of people being tested will go down. As long as our rate continues to go down, that's good. Numerator, denominator staying, proportional, rate going down. These are all good indicators that we're seeing that viral load, community viral load. You're still going to see clusters. You're going to have 20 people together and 18 of them show up positive, right? We're going to still see some of that clustering of disease, but that overall community of disease, we hope to continue to see. So this is a really good statistic to look at, case positivity rate, and as long and you're looking at the fact that you're looking at new cases in March and also looking at the average, our line's going down, which is the trend, those trend, but our average is also half of what it was. All good indicators we're going the right way. Pete, do you have anything?
No, I mean, I think what we're seeing clinically. In the hospital, COVID unit earlier, so we're seeing less people critically ill from COVID disease. It's not zero. I mean, kind of balancing of those two messages, right? There's the balancing of the things are certainly moving better, and everybody is feeling optimistic, right? We don't want to throw rain on that, throw rain on those good feelings, because it's definitely heading in the right direction. But there's still a disease out there. We're now fortunately going to be opening up vaccines to everybody over the age of 16, and we can accelerate that. That more encouragement to continue to get everybody vaccinated so that we can continue to gradually move back into
So do you think you can take this to any other interpretation, like because of the amount of vaccinations, or is there huge herd immunity going on now, weather related?
So I think, Roger, I think there's a couple of things going on. First of all, the hospitalization rates decreasing probably since we hit the right targets, because they're the ones that got the most sick. So targeting the elderly, those with underlying medical conditions. The only underlying medical condition we should have really put in, but so many people are, hypertension does not have good outcomes. We didn't put them in that tier 1 plus, but I think we're seeing some positivity in the decrease in rates in hospitals because we've hit the right targets. We've also seen 80% uptake. And I'm going to just send this out to you. I meant to send it. I might have even mentioned it. I had Monica, one of our public health nurses, do a survey of all of the long-term care facilities. Well, I have data. It's not, there's a couple that were complete, and I was kind of hoping to get it complete. But we've seen about 55% uptake in caregivers in ALS facilities. That's pretty typical to numbers in other places. They're not, those care providers aren't the best uptake in vaccines anyway. But we saw 80% in those receiving care. And that's a good, that's herd immunity in their little population. So it doesn't really equate to herd immunity, but that little cluster's got some pretty significant immunity. So we saw 80% uptake in those receiving care, 55% in caregivers. But and then what we've done with similar populations, ambulatory populations at the clinics, I think is significantly reduced hospitalizations. We still have a long ways to go. There are younger people who get hospitalized with COVID-19. But I think we're seeing that was a good trend. And we still have a lot of work to do. But I think hitting those populations is good. And then just the next page, wanted to mention just this is vaccines administered. This is something that I'm not going to get too far out with you, but I've discussed this with the hospital. I've mentioned this a little bit, but you know, if you look, we're doing about somewhere around 2,600 doses a week, first or second. We're also doing about 70 Johnson & Johnson right now. But it's not a real popular. J&J is not as popular. We don't have a lot, so you did get it. And so we've talked to the hospital about keeping with our tier 1 plus program, 60 and older, but we're going to expand our clinic another hour, and we're going to use that hour to hit. We're going to hit teachers, start with tavern workers. The highest risk people, if you look at it categorically, are those that work in bars. They are the highest. All I had to do was go by a bar last night with Patty's Day. I could tell you there wasn't a mask on anyone. They were outside. That's a big target for us. Teachers are still a target because they're captive in those rooms. So we're going to hit those adult populations. We're going to take an extra hour with about 140 to 150 doses, okay? And we're going to hit that vulnerable population as it relates to that. We're going to continue to do 60 and older, those with underlying medical conditions. We're not changing that number at all. 2574 is still going to be. We're going to take that extra opportunity that hour to hit our vulnerable populations.
Do you have any feel for how much Walgreens right now?
They can do about 30 a day.
But in each location?
In each location. So they're doing 180, and they've hit a lot of teachers.
Yeah.
Good for them.
Yeah. But that is essentially teachers that
Correct. But that leaves School District 5 has at least 300 yet to be vaccinated. Rural schools have not, I have this. But I literally believe in about 4 clinics we can get most of the education staff. Adding that 150 a day.
Is that before the April 1st?
No, or else we will not start before April 1st.
Okay.
Because we're staying within the governor's guidelines.
Right,
Our website's opened up to it,
okay.
but we can categorize. We have all of the filtering capabilities. So they're not going to get, they could get scheduled for April 1st. They won't get done before April 1st.
Are there other, others involved, Greg?
Yes,
I think, wasn't Albertson's one of them?
Albert's, Osco Drugs is a federal partner. Walmart,
Safeway do it?
the Safeway is a federal partner. It just came on a couple weeks ago. We just ordered 100 doses for the medical associates. They're a state partner.
Okay.
Sykes, Columbia Falls,
And
there's a
about
state
Sykes?
partner.
Super one those?
I don't know. I don't.
I've had people ask me and I could only
Yeah.
give a couple names like Sykes. And Walgreens.
Are the federal partners included underneath this grand total? So that we have more vaccine going out than we receive. And then for the Johnson & Johnson's, how are you categorizing those? Because I think like dose 2 is what I think of as people being effectively vaccinated. However, for Johnson & Johnson, just 1 dose. So is there somehow?
So
Yes.
moving forward, after
Yeah.
last Thursday, this column now says dose 2, or it's actually says fully vaccinated.
Okay.
So if you see this next time,
So why is there hesitancy?
I don't know. We had one person come in while I was at the clinic earlier today that wanted to go from Pfizer. I think it's just notoriety. I don't think there's anything scientifically driving a lot of their decisions, except the fact that a lot of people, there is some indication that J&J is a less reactive vaccine than the Pfizer. I think that drives some people, and it's a 1-dose regimen.
So the other two are RNA.
They're a messenger
Yeah.
RNA.
J&J.
It's a adenovirus delivery system, so it's called a viral vector.
I like the standard vaccine, like chicken vaccine.
No, it's an unreplicating, it's a virus that doesn't replicate. It's an attenuated virus, it does not replicate. It literally just delivers the same genome that you're getting in the mRNA or vaccine. So it's a different delivery system.
The Novavax vaccine though will be a more typical vaccine. And that should be available sometime, right? I mean, they're still going through the process. They've had pretty good efficacy trials.
I believe so. I just keep thinking how much vaccine. But so the next viral vector vaccine is, and it was literally produced. It's a really low cost vaccine, and it really is. It should be destined for a lot of development. But we'll see. I don't know if you think any different.
No, I mean, I don't know that I have a whole lot. And some of these others get past the FDA one. Out. But then again, just beyond the scope of our discussion here to try to postulate or where surplus vaccine and hopefully live in the world of everybody as long as developing countries the pandemic is still circulating.
Roger, just my last point is, Pete, that's where the messaging needs to be. Because if we're going to do great in the United States, Israel's done great. They're one of 90 uptake is amazing. Our uptake could be great, but if we let this virus just sit around like the flu virus does in India and shift and drift genetically, it's going to come roaring back as soon as our vaccines don't cover it. So, I mean, we need to get people vaccinated so we get that whole viral load down, so we don't have these mutations that could make the vaccine ineffective. So I hope we get something going.
Is there any significant evidence anywhere in the world on the reinfection of people who had it once or have been inoculated?
But we're seeing the other things, we saw a real interesting case the other day, someone that was fully durably immunized, became infected only because it was they were a close contact. And when they tested positive for coronavirus infection. But if you think about that, that parallels what we've always been told is some people will get asymptomatic infection and have low viral load. That will happen, but when you're both vaccinated, the likelihood you're going to transmit it gets lower and lower because you're immune and they're showing very low virus load. So we're going to see some.
But we haven't seen any significant impact.
Not a significant number.
Yeah.
You see sporadic cases.
And the second question,
And then, I'm sorry to interrupt, Bill, but
Sure.
then also, the illness severity. I mean, you may that illness on times again, not overly common, but we do see it. But then the most important thing is the illness severity.
follow-up question, is it because you know how to treat it now? Or
You know,
nobody does?
your body is actually knows how to turn it off.
There's probably two factors. Medical science is advancing, you can treat it better.
Yeah, well, I mean, no, I think it's more the latter, that your body has seen it before, so even though you might get some mild illness, your body fight it off more efficiently.
Both of them are good answers. Secondly, is there any significant evidence on the vaccines, on the new permutations, new variants from Brazil and South Africa, I think was the other?
Well, what I've heard is UK strain, that B117, pretty good alignment, and the vaccine's very effective. I've heard the efficacy drops a little bit with the South African and Brazil strain. Still is an effective vaccine, but the J&J may be a little bit higher efficacy with the South African. They did clinical trials. They're all still immunizing you to these new variants. The efficacy may have dropped a little bit, but they're still effective. They're still more effective than the flu vaccine. I mean, I hate to throw the flu vaccine in the bus, but in an older population, the flu vaccine could be 40% effective.
My questions are a little bit forecasting. I know that we're in the middle of a marathon of vaccines, significant ramping up. But I've been reading some things that I think I've always talked on health board about the other effects of the pandemic, isolation, suicide, stuff like that. And just sort of looking at our population health numbers, how do you see the department being able to ramp back up some of the population health, base of community health that are not COVID related, so that we get more people in, because that really helps our numbers really. How do we, and I hear about it from senior services, that we just know that there's a population that's been sort of fearful throughout this year. They are more isolated, that they are also not connecting with their services. And that's sort of where we also have that other underlying issue of isolation and suicide, how do we start to have a vision, the department trying to get beyond vaccines and back into that population health or community health lane that we're sort of not doing it. So
Well, Roger, Kyle, I think that, I mean, I'm very cognizant of that. I will tell you that a lot of our population health staff does have insurance. We're trying to identify, we're actually starting to use volunteers where our population health staff does a lot of the registration stuff. We're starting to move volunteers, people volunteers into there, because I'd like to get some of our population health staff rolling back into their programs. So we're already doing that, and we need to do more of that. I think I'm really trying to push a lot of folks back into the
and then I guess the other question is, after the recovery act, what type of debriefs department lessons learned? Communication is one of the things that we've been across a couple of times. How do we position ourselves better if there is a set way or something that comes, a future pandemic that would come from it? That's the word, in a better position. Because there's sometimes I feel like we haven't. I just want to make sure that the debriefs of what really didn't work this last year, where actually is there communication? Should have always had a meeting with our call center or two.
Well, it's a good question. I'm not even sure that I can adequately respond. I can tell you from we practice points of distance all the time. What we do in that vaccine clinic, we're really. I don't have any. I can say that without a qualm. I mean, we're as good as anyone at delivering vaccine. I can tell you this happened before. Managing the contact tracing side of it could have been a little challenging at times. I thought the hospital gave us a registered nurse, which really helped us. She assumed the deputy operations role. She was able to manage a lot of that. She's actually going back to the hospital Monday, but Mary Larson did really nice work for us and helped with that internally. It's to manage that much epidemiological activity is significantly hard because you don't know how much you need to emphasize, you don't know where you need to de-emphasize. I think we have a lot of lessons learned going forward, and I think we're going to see that nationally because we all did contact tracing. So we probably do have some lessons learned on that side. I mean, we had some total crashes. I can't have nothing to do with it. I say that as hearsay. We lost nurses because of the contact tracing side. We lost staff that were literally just, they left. So we have some lessons learned on that side. How do you balance delivering other public health activities and continuing to respond to the worst pandemic in 102 years? I think we can take a little solace that no one is going to be perfect at this, and we have a lot to learn. But you know, we have to do some balance. I thought the staff moving forward doing the flu clinic in October was a great move. They could have literally said, "Screw it, we're just going to do contact tracing, and we'll just let it go." But no, we did 1,200 influenza. So there's some positive things that happen, but I'm sure there's a lot that we're.
I guess my thought is that because with the American Care Act, that really ends up being our sort of one-time funds that we have out there, and if there's things that need to be supplemented, that we wish it would do better, that we should find that funding that's moving towards that.
I think that's a question above the health department, because I think the health department did everything they could to manage that. They were to the point where we pretty much were hanging on by a thread Department spent. And but we've started to manage that much tighter. How this next phase rolls out, I'm not going to make Roger any more crazy than he is about it. So we'll have to see. But there will be a lot of discussion.
All right.
Can you just mention the legislative stuff real quick?
Yeah.
Yeah, so I haven't been overly active with the legislative session, even without it. And we're really watching House Bill 121 and Senate Bill 108. Those are the ones that use the term strip powers. Health. Representative Beatty's bills, House Bill 121, is something that Representative Beatty has actually been pretty supportive in making some amendments to the point where we can live with it. You know, the model of having governing bodies participate in Board of Health activities is not new. We've done that with our air pollution control program. We have to go through the Board of Health and all governing bodies in the city and county where it impacts them. So I've already been through this model that he's putting out there. I have no objection to it, but we can. Senate Bill 108, on the other hand, is a pile of garbage. And I don't mind saying that the sponsor does not like me after I testified on this bill, but they don't know what they know. And this thing, you couldn't take action on a restaurant without going to the government. We can't. Beatty's bill does nothing to change our responsibility. So we're still in line with hoping, and the governor has basically said, I'm signing either 121 or 108. So if that's his mandate, we want one. So, House Bill 620 was actually the family planning revenue bill, and I did support that. That was actually carried by Amy. So we did support that. We've always been counting that it lines up with on it. So mentioned anymore, but we did support that. I will send you my testimony on Senate Bill 199. That's the food freedom and milk bill. And as a public health person, I can't support that. If we're going to do raw milk in Montana, we should do it right. We should do it like Washington State has done it, where there's strict controls on it, where it's labeled properly, so where it's tested, and the testing actually can stop the milk from being produced. Right now, they could do a test. The Department of Livestock said, yeah, you test, but unless there's a foodborne outbreak, you don't have to supply test results. So you never get in front of bad milk. And all milk that's pasteurized is always tested. It's always tested. And they'll throw it out if it can't meet pasteurization levels. So not very supportive of it. The other side is the food freedom, which basically says anyone, as long as it's a transactional. No labeling, no sanitary conditions. We did all of this work in 2015 with the Food Act bill, which really works. It's a good bill and people like it. And now they're basically throwing cottage food to the curb, saying, we don't care about that. You can make anything in your home, do a one-to-one transaction, it doesn't matter. So it's a pretty scary bill. If they're going to do anything, they need to go to a study session and really look at it. This is not the way to do it. So that's all I'm doing with legislation. I did provide Pam some help on Jeff's bill this morning. I provided her some information on some testimonies. So that's about it for me.
Anybody have any questions?
Have the commissioners taken a position on any of these bills?
The only commissioner I talked to about legislating on our board. So Pam and I are fairly in alignment on on this. I'm actually very much enjoy Pam's position. I'm going to say this. She's not very supportive of these bills. She knows as county commissioner, she can appoint board members or unappoint board members. And, you know, they always have the power of the purse if they don't like what's going on. So Pam doesn't really see a lot of mess.
I'm comforted by that.
I've been very comforted.
Second question, do you think that it would help you and the other health officers in the state to have your individual boards provide support for the testimony you provided?
You know, Bill, I actually think that depending on what comes out, if 121 comes out, it might be good for some letters to the governor at that point to support it. He's going to support one or the other. 108 is and it's so.
I read both of them and I thought it was probably written by a seventh grader.
Yeah, you should have heard the sponsor make public comments about me after I provided testimony, alluding to the fact that what he wrote didn't make any sense. But he was pretty offended by my comments.
Well, thank you for the update on those things. Is that takes care of our reports. I just, one question in general, what is the status of the community health center CISM?
So we've been working outside of our coordinating, primarily on the lease and things that we've had to break up. The electronic medical records is been shared. So we're actually, right now, we're one facility and all of our providers are in one pool. So we're breaking that into two facilities. There'll be a health department at one facility, health centers together. So we're breaking that up. Our activities in billing, scheduling, utilizations, and things. So that's all good to go. We're ready to do that. You know, there's a lot of IT stuff that's really not up to us. IT and phone system is really something that the health center needs with the appropriate county departments. We're pretty much sure where we're moving forward with the lease. I am going to meet with our side of the coordinating committee right after this meeting and do a briefing on where we are. We haven't engaged. We're engaged, but we haven't engaged to redo the lease yet. So that would be the next step. Is the big thing left is really the lease, and also the fact that I will provide you an update. All health department employees associated with the health center, I have a draft letter that separates them from service with the health department. That's another big step. And because of the bargaining, we'll have to, there'll be that roll down, you know, oh, I can take your job. So that will start a period of looking at the HR matters that say, I don't want to go with the health center, I want to stay with the health department. So there'll be some folks that possibly will be looking at trying to keep their employment with the health department. So we're hoping that that's minimal or negligible, but we're not sure yet about that. But that is, you know, anytime you riff someone, it's just kind of a roll down system. So that's where we are with that. So everything's in line, Roger, for a separation. But the big thing is going to be the board, the county commission, and the health center board negotiating that lease, the new lease, because that's pretty much going to happen. I have a draft lease. We need to work on some planning, financial planning.
Oh,
They're staying here, Roger. Yeah, No, they're not going. They're, I mean, they quite frankly couldn't afford to go anywhere else. I mean, if you know anything about medical, you either bought a building or lease it, and they're not going anywhere. They're certainly not going to build a medical facility in this day and age. So they just, the commissioners started this whole, we want to negotiate the lease. It needs to be structured differently because the lease was between divisions, right? They just have their own money. Now it has to be between literally a landlord and lease. So that's where we're moving.
Well, you
Just
can
a
give
follow-up question. Could we next month maybe have a good overview of what all's happened in the health center, where we are, and sort of a vision of what the partnership going forward is? Just, it's been a crazy year since we even started the conversation about the separation. We've always had COVID going on. I feel like we have a couple of new board members, but we also the public sort of, we haven't had a really good, robust conversation about some of the history of some of where we are, like what the different roles are, but also just a vision of what that's moving forward is. I'm hearing some comments in the community of being, the whole health department is leaving, not the county. And it just, I think part of it is, I don't know that they know exactly health center, what their role is, health department's role is, what that looks like. I'm just not sure that we've ever spoken that into the public record. Definitely not in the last year. Which I think it would be helpful so that I mean, back to some records. Just go back to some records. I think we're all finding that there's some things which, because we're not as open, I haven't had that discussion. Haven't.
I was gonna ask for the same thing.
Sorry.
Need to get out.
Well, oh, I'm sorry. The Interlake has already approached me, writing a similar article than of what you are talking about. And I don't, we're going to pick it up again this week because I had given them some information last week. But I don't know where they are.
Yeah, I mean, because in that last summer that we had, we're deciding which grants that we were keeping versus the ones that we let go. So, and with the, there was some of that that should, but yeah, I mean, I fleshed out more. Yeah, which services.
And again, I think emphasizing sort of historically where we've been, where we are today, but also the opportunity does that having a partner who is not part of the county that is able to mobilize and do something that we're not able to do, and how we, the health department, can leverage and utilize that partnership that's out there that we have a pretty strong alignment with. That all of those have to go through the process to address community that. Maybe it's going to be freeing for us. The community needs to know this is actually potentially a good development. And an opportunity.
I have two comments. I support Kyle's recommendation. I think it's an excellent idea. The second is, I see Mary, she's still there. She's in the hospital. Yeah, she's still there. Ask her if she would like to participate in answering what Joe answered, or if there's any disagreement. I didn't sense any, but
No,
Mr. Chair, what invite her? There she is.
Yeah, Mary, do you have any comments you'd like to provide?
Yeah, I'm working on my TV angles here. I would welcome an opportunity to have some closure and to discuss sort of where we're at and going forward. You know, I think there is a lot of change involved, but then a lot of things that will stay the same. So I would be happy to work with Joe and prepare something for the next Board of Health meeting. I would welcome it.
We appreciate hearing from you, so.
Great. Terrific.
schedule you in.
All right. Thank you.
Here. All right, with that, I guess it's board member comments.
We're hitting an anniversary date of where we have been with COVID and all this whole process. I mentioned it at city council. My first meeting that I remember coming in for a special meeting was the day before St. Patrick's. Everyone, great staff. We have to find that way to have some debrief and say, what can we do better? How can we do it along the year? Oh, we're at the point where vaccines are actually show up.
Dr. Abel.
Get your shot, get your shot, get your shot, get your shot.
Artist.
Well, first I want to thank Joe, because I went out to the clinic a couple weeks ago, and well, everybody, it was amazing how organized it was, and everybody who left, I talked to a few of them, they were pretty excited that they had that opportunity and how smooth it truly went, and so, and I echo what Kyle said too, is we've got to just kind of figure out where we're all gonna go and what we've learned and so forth, so I want to thank everybody for all of it.
Yeah, no, I totally agree. I got my vaccine a week ago. They actually had 100 extra that they had that day and had to call people in. And my appointment was at 3:30 and I was in at 3:33 and they handled 100 extra cases. So it was a well-run shop. Really impressed. And I guess the only other comment is next time you decide to do a tavern census, let me know.
I'll go with you.
Jessica.
I would say I'm really impressed, of course, with Joe and the health department in general, but also it's encouraging to see that our numbers are going down, but we still have quite a few infections, especially if you look at our, as a county, positive cases versus other counties around us. We're still in a space where we need to remember that it's still important to protect the most vulnerable in our community, because even like some of my most vulnerable neighbors haven't had the vaccine yet, and I see them out walking the dogs. So I think it's just important that we continue to respect each other, and by social distancing and using public hygiene measures, as well as wearing our masks and getting vaccinated, we have an opportunity to. So, I mean, everybody.
Thank you. So I guess with that, I'd entertain a motion to adjourn.
I'll make a motion to adjourn.
Thanks for all attending.